Hello, hi, namaskar. This is Anish Kumar, and you are watching The Pharmacist. Today, we are going to discuss Diploma course in Pharmacy syllabus. This course and the syllabus is provided by the Pharmacy Council of India, constituted under the Pharmacy Act of 1948. This is the latest syllabus based on the Regulation 7, the Education Regulation 2020 for Diploma course in Pharmacy. So we are going to take a look, and this syllabus is going to be beneficial for the students of the pharmacy, Diploma in Pharmacy students, as well as the students seeking admission in the Diploma in Pharmacy course. Also, the students who have passed this Diploma in Pharmacy and are preparing for the government jobs. So this syllabus is the base for your education of the Diploma in Pharmacy. Pharmacy Council of India, New Delhi. Now let's take a look on the contents. Preamble on the page number 1, competencies for the Indian Pharm holders on page number 3, competencies mapping with the course part 1, 2 and 3 of the Education Regulation 2020 on page number 5, Education Regulation 2020 Pharm syllabus and overview on page number 6, guidelines for the conduct of theory examinations on page number 8, guidelines for the conduct of practical examination on page number 9, Education Regulation 2020 Pharm syllabus part 1 on page number 11, Education Regulation 2020 Pharm syllabus part 2 on page number 37 and appendices on page number 69. Now take a look on the preamble. I am going to read a few lines of this preamble. You can go through the complete passage. I will provide the PDF. Now let's take a look. Revamping the curriculum, pedagogy, assessment and student support is one of the vision statement and recommendations of the National Education Policy NEP Government of India for attaining enhanced learning experiences by the student. In light of this, Pharmacy Council of India, the apex body regulating the pharmacy education in the country, committed to revise the education regulation of Diploma in Pharmacy (DPharm) program, and thus the Education Regulation 2020 (ER20) has been notified in the Gazette of India in October 2020. This new regulation has due consideration for the fact that universally the roles of pharmacists undergo continuous evolution from that of dispenser of medicine to that of medicine expert in the multidisciplinary health care team. Now let's move to the next part, that is competencies for the Indian Pharm holders. So you must have all these competencies. What is competency? Competency is defined as a distinct composite of knowledge, skill, attitude and the value that is essential to the practice of the profession in a real life contexts. The candidate who successfully complete the Diploma in Pharmacy DPharm program of Education Regulation 2020 (ER 2020) from the institutions approved by the Pharmacy Council of India are expected to attain the following professional competencies. One thing I would like to tell you, that if you are a student and seeking admission in the Diploma in Pharmacy course or any course related to pharmacy, you must search the name of your college in the list of approved colleges of the website of Pharmacy Council of India. If your college name is present there and the approval is provided to them, you can take admission. If not, then you are going to face problems when you will go for registration. A pharmacist need to be registered in their own or respective states after the completion of this diploma in pharmacy course. So only registered pharmacists can practice. So when you will go for registration, you might face the problem if your college is not approved by the Pharmacy Council of India. Let's move ahead. So these competencies you must have if you are a pharmacist or are going to become a pharmacist. Review the prescriptions. Definitely you must have capability to review the prescription. Second, dispense the prescription. Non-prescription medicines as well. Provide patient counseling education. Hospital and community pharmacy management. Expertise on medication. Definitely you must be an expert. Proficiency on drug and pharmaceuticals. Entrepreneurship and leadership skills. Deliver primary and preventive health care. So if you have knowledge, what would you do with that knowledge? You'll have to serve the humanity, definitely. Professional, ethical and legal practice. You must follow the laws. And your practice must be ethical for the humanity, for the benefit of the society. Continuing professional development. You have to support the professional development, right? Because you are the leader. You are the role model of the pharmacy. Now let's take a look one by one. Review the prescription. The student should receive and handle the prescription in a professional manner and be able to check for its completeness and correctness. Also, the prescriber should be contacted for any clarification and corrections in the prescriptions with suggestions if any. So if you find any error in the prescription, or you are unable to understand the prescription due to non-legible writing or any other issues, you can contact the prescriber. But you'll have to make sure that the prescription should be dispensed correctly. So dispense prescriptions, non-prescription medicines. The student should be able to dispense the various scheduled drugs, medicines as per the implications of the Drug and Cosmetic Act and rules thereunder. Also, the non-prescription medicines, over-the-counter medicines or the drugs should be dispensed judicially to the patients as required, right? Definitely you have to follow the rules and regulations. Provide patient counseling education. The student should be able to effectively counsel, educate the patient, caretakers about the prescription, non-prescriptions, medicines and other health related issues. Effective communication includes using both oral and written communication skills and various communication techniques that you will definitely going to learn while the course, as well as while the practical training would be there. So you will learn how to communicate the people, not just only verbal communication will be sufficient. You'll have to use your hands to indicate them and to make them easily understand. So you will learn this skill to educate, and patient must have confidence in you, and the confidence will come with the knowledge that you provide to them. You must be educated and skillful and knowledgeable enough to deal with the patients and to win their confidence. Now let's move. Hospital and community pharmacy management. The student should be able to manage the drug distribution system as per the policies, guidelines of the hospital management. Good community pharmacy practice and recommendations of regulation agencies. Also be able to manage the procurement, inventory and distribution of the medicine in a hospital community pharmacy settings. So this is your main job role: procurement, inventory and distribution of the medicines in the hospital. Yes. Now let's move to the expertise on medication. You must be an expert, buddy. If you are a pharmacist, what is the main characteristic of a pharmacist? Knowledge, knowledge of medicine, nothing else. So you must be expert. The student should be able to provide an expert opinion on medications to the healthcare professionals on the safe and effective medication use, relevant policies and procedures based on the available evidences. So you must be able to communicate with your colleague and the your hospital staff. You must educate them and provide them information when they ask for it. You must have the sufficient information and knowledge with the authentic sources, right? So you will feel that when you will come in the profession, you will feel that the other professionals will ask you about the help, so you must be knowledgeable enough to support them and help them. So you'll have to achieve a lot of knowledge. Knowledge is the power of success, or the key of success. Now let's move to the point number 6. The student should be able to describe the chemistry, characteristics, types, materials, merits and demerits of both drugs and excipients used in the pharmaceutical formulation based on his or knowledge and skills, knowledge and scientific resources. When you will be dealing with the drugs, cosmetics, medicines and the cosmetics must have the some ingredients. So there will be different characteristics of each ingredient. So if there is any harmful or sensitive ingredient in that, you must know about that. So when will you know? When you will read. 7. Entrepreneurship and leadership. You are the leader, buddy. You are the leader. A pharmacist is a leader. So you must have leadership skills. You are the leader if you have chosen the pharmacy. The student should be able to acquire the entrepreneurship skill in the dynamic professional environment. Also be able to achieve leadership skills through teamwork and sound decision making skills. So you must have a team leading skills and teamwork skills, and you'll be sound enough or capable enough to take decisions because you have skills, knowledge. What will you do with that if you are not capable enough to take decisions? You must have the decision taking capabilities, right? Say for example, if you have knowledge about a medicine, that this medicine is used in this particular disease, then what will you do with this information? Use it for the humanity, right? Deliver primary and preventive healthcare. The student should be able to contribute to the various healthcare program of the nation, including disease prevention initiative to improve public health. Also contribute to the promotion of national health policies. The government of India and the respective and the state governments make various policies for the helping for helping the people of their state. So you must follow the guidelines and support the government for achieving the goals related to that policy or the vision of that particular government. Say for example, eradication of tuberculosis, right? So government have a vision to eradicate the tuberculosis. So you must support the government by taking part in the their programs. Also, awareing the people about the government initiatives, right? 9. Professional, ethical, and legal practice. Yes, the student should be able to deliver the professional services in accordance with legal, ethical, and professional guidelines. You should not be, using the your knowledge for the harming or unethical way, right? So you will have to use your knowledge and information only for the benefit of the society. This is your key responsibility. Understood? Yes. Now let's move to the point number 10. Continuing professional development. You are the leader, you'll have to lead this profession. The student should be able to recognize the gaps in the knowledge and skills in the effective delivery of the professional services from time to time and be self motivated to bridge such gaps by attending continuing professional development programs. So we should take part in the professional development programs so that we can update ourselves and update others as well. Now let's take a look of these competencies and this mapping of the competencies. Left hand side, point 1 to 10 are the competencies which you are going to read or the learn in the following subjects provided on the top right. So let's take a look on the subjects: pharmaceutics, pharmaceutical chemistry, pharmacognosy, human anatomy and physiology, social pharmacy, pharmacology, community pharmacy and management, biochemistry and clinical pathology, pharmacotherapeutics, hospital and clinical pharmacy, pharmacy law and ethics, and practical training. Now let's move to next part: Education Regulation 2020 Pharm syllabus and overview. You must go through this overview, right? So this will provide an overview about the pharmacy profession and the detailed inside of the pharmacy. So I'll be reading only a few lines. Say for example, the education regulation Pharm syllabus has following structure in every course. Through the theory and practical courses are not mutually exclusive as per the regulation. The theory and practical are to be considered as individual courses. Definitely theory is very different from the practical. You read in the theory but you learn in the practical, right? Scope: these are the broader statement on the purpose of course in the curriculum, key content of the course that will contribute to the specific knowledge and skill development. The teacher is expected to orient the student about the scope of the particular course at the beginning and intermittently. So I'll going to only read the points. Course objectives, course outcomes. You can pause and read as well. Theory courses, practical courses, tutorials, assignments, field visits, practical training. Now let's take a look on the criteria. These are merits. These are criteria. Now let's move. Guidelines for the conduct of theory examinations. These are sessional exams. So you will learn these things in your academics. You can pause and read. We are directly going to the syllabus now. This is the part 1. First subject, pharmaceutics theory. Let's take a look on this syllabus. Scope. This course is designed to impact the basic knowledge and skills on the art and science of formulating and dispensing different pharmaceutical dosage forms. So in pharmaceutics, you will learn how to make medicines, cosmetics, right? So in pharmaceutics, you will learn about the various ingredients which are used in the medicines, cosmetics, and all these things. You will also learn about the machineries in the higher classes. Now let's move to the course objective. This course will discuss the following aspects of pharmaceutical dosage forms. 1. Basic concepts, types and needs. Advantages and disadvantages, methods of preparation, formulation, packaging and labeling requirements. Basic quality control test, concepts of quality assurance and good manufacturing practices. Course outcomes. Upon successful completion of this course, the students will be able to describe about the different dosage forms and their formulation aspects, explain the advantages, disadvantages and quality control test of different dosage forms, discuss the importance, quality assurance and good manufacturing practices. Chapter 1. History of the profession of pharmacy in India, relation to pharmacy education, industry, pharmacy practice and various professional association. Pharmacy as a career. Pharmacopoeia, you learn about the pharmacopoeias. Introduction to IP, that is Indian Pharmacopoeia. BP, British Pharmacopoeia. USP, United States Pharmacopoeia. NF, National Formulary and Extra Pharmacopoeia. Salient features of Indian Pharmacopoeia. Chapter 2. Packaging material, types, selection, criteria, advantages and disadvantages of glass, plastic, metal, rubber as packaging material. So the packaging material that are used to pack the medicines and cosmetics. So you will learn about that as well. Chapter 3. Pharmaceutical aids, organoleptics, that is coloring, flavoring and sweetening agents. Preservatives, what are preservatives? Definition, types with examples and uses. Chapter 4. Unit operations, definitions, objective applications, principles, constructions and working of. Size reduction, that is hammer mill, and we are going to basically read the machineries in this chapter. So size reduction, to reduce the size of that medicine, hammer mill and ball mill. Size separation, classification, powder according to IP, cyclone separator, sieves and standards of sieves. Mixing, double cone blender, turbine mixer, triple roller mill and Silverson mixer homogenizer. Filtration, theory of filtration, membrane filter and sintered glass filter. Drying, working of fluidized bed dryer and process of freeze drying. Extraction, definition, classification, method and applications. Chapter 5. Tablet, coated and uncoated, various modified tablets, sustained released, extended release, fast dissolving and double layered. Capsules, hard and soft gelatin capsules. liquid oral preparations, solutions, syrups, elixirs, emulsions, suspensions, dry powder for reconstitution, topical preparations, ointment, creams, pastes, gels, liniments and lotions, suppositories and pessaries, nasal preparations, ear preparations, powder and granules, insufflations, dusting powders, effervescent powders and effervescent granules, sterile formulations, injectables, eye drops and eye ointments, immunological products, sera, vaccine, toxoid and their manufacturing methods. 6. Basic structure, layout, sections and activities of pharmaceutical manufacturing plants, quality control and quality assurance. Definition and concept of quality control and quality assurance, current good manufacturing practices, CGMP, introduction to concept of calibration and validation. Chapter 7, novel drug delivery system, introduction, classification with examples, advantages and challenges. So this was all about the theory course of pharmaceutics. Now take a look of the practical as well. Pharmaceutics practical. Here are course code is given and the hours in which it will be completed by your teacher. Scope. This course is designed to train the student in formulating and dispensing common pharmaceutical dosage forms. Course objective. Just give a second. Course objective. This course will be discussed and train the following aspects of preparing and dispensing the various pharmaceutical dosage forms. 1. Calculation of working formula from the official master formula. 2. Formulations of dosage forms based on working formula. 3. Appropriate packaging and labeling requirements. 4. Methods of basic quality control test. Students, I will assure that I'm going to assure you that when you will take admission in the pharmacy course and you will go for the experiments or the lab for the practical learning, you will definitely going to enjoy this process. You'll learn how to make the medicines and the cosmetics and the formulation, various formulation, say for example liquid preparations, oral preparations, right, syrups, elixirs, various formulations, various cosmetics, say for example cream, ointment and other preparations. So you will learn and you will enjoy that process, right? So let's move ahead. Course outcomes. Upon successful completion of this course, the student will be able to calculate the working formula from the given master formula. So you will be making the quantities, small quantities in the lab, and you'll have to make the large quantities in the industry. So you must know about the working formula. So you will learn in the course, formulate the dosage form and dispense in appropriate container, design the label with necessary product and patient information, Perform the basic quality control test for common dosage forms. Practicals. 1. Handling and referring the official references, pharmacopoeias, formularies, etc. For retrieving formulas, procedures, etc. 2. Formulations of the following dosage form as per monograph standards and dispensing with appropriate packaging and labeling. Liquid oral, simple syrup, piperazine citrate mixture, aqueous iodine solution, strong iodine solution. Emulsions, castor oil emulsions, cod liver oil emulsions, olive oil emulsions. Suspensions, calamine lotion, magnesium hydroxide mixture. Ointment, simple ointment base, sulfur ointment. Cream, cetrimide cream. Gel, sodium alginate gel. Liniment, turpentine liniment, white liniment, BPC. Dry powder, effervescent powder granule, dusting powder, sterile injection, normal saline, calcium gluconate injection. So see, you will be making these medicines. These are medicines that is going to be used in the real life situations, hospitals, industries, hospitals and institutions, right? Dispensaries, clinics. These medicines that you will make will be used. Tablets, you will make the paracetamol tablet granules ready for compression. Demonstration on various stages of tablet manufacturing process, including coating tablet if possible, appropriate methods of uses and storage of special dosage forms, including different types of inhalers, spacers, insulin pens. Demonstration of quality control test and evaluation of common dosage forms, which tablet, capsules, emulsions, sterile injections as per monographs. Assignments. The student shall be asked to submit the written assignments on the following topics. One assignment per student per sessional period, that is a minimum 3 assignment per student. Various systems of measure commonly used in prescribing, compounding and dispensing practices. Market preparations including fixed dose combinations, each type of dosage forms, generic name, minimum 3 brand names and label contents of the dosage forms mentioned in the theory practical. This assignment will be definitely going to give real life insights of the this pharmacy profession. Overview of various machines, equipments, instruments involved in the formulations and quality control of various dosage form pharmaceutical formulations. Overview of extemporaneous preparations at community hospital pharmacy versus manufacturing of dosage forms at industrial level. Basic pharmaceuticals calculations, ratios, conversions to percentage fraction, allegations, proof spirit and isotonicity. Also field visit. The student shall be taken for the industrial visit to pharmaceutical industries to witness and understand the various process of manufacturing of any of the common dosage form, which tablet, capsule, liquid, oral, injectables, etc. Individuals reports from each student on their learning experiences from the field visit shall be submitted. Now pharmaceutical chemistry, next syllabus, the pharmaceutical chemistry theory. Scope. This course is designed to impart the basic knowledge on the chemical structure, storage conditions, and medicinal uses of organic and inorganic chemical substances used as drug and pharmaceuticals. Also, this course discusses the impurities, quality control aspects of chemical substances used in pharmaceuticals. Course objectives. This course will be discussed in the following aspects of the chemical substances used as drug and pharmaceuticals for various disease conditions. 1. Chemical classification, chemical name, chemical structure. 2. Pharmacological uses, doses, stability and storage conditions. 3. Different types of formulations, doses, forms available and their brand names. 4. Impurities testing and basic quality control tests. Course outcome. Upon successful completion of this course, the student will be able to describe the chemical class, structure and chemical name of the commonly used drug and pharmaceuticals of both organic and inorganic nature. Discuss the pharmacological uses, doses, regimes, stability issues and storage conditions of all such chemical substances commonly used as drugs. Describe the quantitative and qualitative analysis, impurity testing of the chemical substances given in the official monographs. Identify the dosage forms and the brand names of the drug and pharmaceuticals popular in the market. Chapter 1. Topic: Introduction to Pharmaceutical Chemistry. Scope and objective. Sources and types of errors, accuracy, precision and significant figures. Impurities in pharmaceuticals, sources and effect of impurities in the pharmacopoeial substances, importance of limit test, principle and procedures of limit test for the chloride, sulfate, iron, heavy metals and arsenic. 2. Volumetric analysis, fundamentals of volumetric analysis, acid-base titrations, non-aqueous titration, precipitation titrations, complexometric titrations, redox titration, then gravimetric analysis, principle and method. Chapter 3. Inorganic pharmaceuticals, pharmaceutical formulations, market preparations, storage conditions and uses of hematinics, ferrous sulfate, ferrous fumarate, ferric ammonium citrate, ferrous ascorbate, carbonyl iron, antacids, aluminum hydroxide gel, magnesium hydroxide, megaldrate, sodium bicarbonate, calcium carbonate, antimicrobial agents, silver nitrate, ionic silver, chlorhexidine gluconate, hydrogen peroxide, boric acid, bleaching powder, potassium permanganate, dental products, calcium carbonate, sodium fluoride, denture cleaners, denture adhesives, mouthwashes, medicinal gases, carbon dioxide, nitrous oxide and oxygen. Chapter 4. Introduction to nomenclature of organic chemical system with particular references to heterocyclic compounds containing up to 3 rings. Study of the following categories of medicinal compound with respect to the classification, chemical name, chemical structure, compound marked with star, uses. Chemical structures, you'll have to read only the medicines marked with star. Uses, stability and storage conditions, different types of formulations and their popular brand names. Drugs acting on central nervous system. Chapter 5. Drugs acting on central nervous system. Anesthetics, thiopental sodium, ketamine, hydrochloride, propofol. Sedatives and hypnotics, diazepam, alprazolam, nitrazepam, phenobarbital. Antipsychotics, chlorpromazine, hydrochloride, chlorpromazine hydrochloride, haloperidol, risperidone, sulpiride, olanzapine, quinceapine, lorazepam. Now anticonvulsants: phenytoin, carbamazepine, clonazepam, valproic acid, gabapentin, topiramate, vigabatrin, lamotrigine. Antidepressants: amitriptyline, amitriptyline hydrochloride, imipramine hydrochloride, fluoxetine, venlafaxine, duloxetine, sertraline, citalopram, escitalopram, fluoxamine, paroxetine. Now chapter 6: drugs acting on autonomic nervous system. Sympathomimetic agents: direct acting: norepinephrine, epinephrine, phenylphrine, dopamine, terbutaline, salbutamol or albuterol, nefazoline, tetrahydrozoline. Indirect acting agents: hydroxyamphetamine, pseudoephedrine agents with mixed mechanism, that is ephedrine and metaraminol. Adrenergic antagonist: alpha adrenergic blockers, tolazoline, phentolamine or phentolamine, phenoxybenzamine, prazosin, beta adrenergic blockers, propranolol, atenolol, carvedilol. Cholinergic drugs and related agents: direct acting agents: acetylcholine, carbachol and pilocarpine. Cholinesterase inhibitors: neostigmine, androphonium chloride, tacrine hydrochloride, pralidoxine chloride, ecothiopate iodide. Cholinergic blocking agents: atropine sulfate, ipratropium bromide. Synthetic cholinergic blocking agents: tropicamide, cyclopentolate hydrochloride, cladinium bromide, dicyclomine hydrochloride. Chapter 7: drugs acting on cardiovascular system. Antiarrhythmic drugs: quinidine sulfate, procainamide hydrochloride, verapamil, phenytoin sodium, lidocaine hydrochloride, lorcainide hydrochloride, amiodarone and sotalol. Antihypertensive agents: propranolol, captopril, ramipril, methyldopate hydrochloride, clonidine hydrochloride, hydralazine hydrochloride, nifedipine. Anti-anginal agents: isosorbide dinitrate. Chapter 8: diuretics. Acetazolamide, furosemide or fusamide, bumetanide, chlorthalidone, benzthiazide, metolazone, zipamide, spironolactone. 9. Hypoglycemic agents or anti-diabetic medicines: insulin and its preparations, metformin, glibenclamide, glimepiride, pioglitazone, repaglinide, gliflozins, and gliptins. Chapter 10, analgesic and anti-inflammatory agents, morphine, analogs, narcotic antagonists, non-steroidal anti-inflammatory agent, that is NSAIDs, aspirin, diclofenac, ibuprofen, piroxicam, celecoxib, mefenamic acid, paracetamol, aceclofenac. Chapter 11, anti-infective agents, antifungal agents, amphotericin B, glycofulvin, miconazole, ketoconazole, itraconazole, fluconazole, naphthene hydrochloride, urinary tract anti-infective agents, norfloxacin, ciprofloxacin, ofloxacin, moxifloxacin. Anti-tubercular agents, INH, ethambutol. INH is isoniazid, E for ethambutol, P para-aminosalicylate acid, this P for pyrazinamide, R is symbolized for rifampin or rifampicin, right? Bedaquiline, delaminad, pretominad. Antiviral agents, amantadine hydrochloride, idoxuridine, acyclovir, foscarnet, zidovudine, ribavirin, remdesivir, favipiravir. Anti-malarials, quinine sulfate, chloroquine phosphate, primaquine phosphate, mefloquine, cycloguanil, pyrimethamine, artemisinin, sulfonamides, sulfanilamide, sulfadiazine, sulfamethoxazole, sulfacetamide, methanide acetate, cotrimoxazole, dapsone. Chapter 12, antibiotics, penicillin G, amoxicillin, cloxacillin, streptomycin. Tetracyclines are doxycycline, minocycline, macrolides, erythromycins and azithromycins, miscellaneous, chloramphenicol and clindamycin. Chapter 13, antineoplastic agents, cyclophosphamide, busulfan, mercaptopurine, fluorouracil or 5-fluorouracil, methotrexate or MTX, dactinomycin, doxorubicin hydrochloride, vinblastine sulfate, cisplatin, dromostanolone propionate. Now let's move to the pharmaceutical chemistry practical scope. This course is designed to impart the basic training and hands-on experiences to synthesize chemical substances used as drug and pharmaceuticals, also to perform the quality control test, impurities testing, test for purity, and systematic qualitative analysis of chemical substances used as drug and pharmaceuticals. Course objective: this course will provide the hands-on experience on the following aspects of chemical substances used as drug and pharmaceuticals. 1. Limit test and analysis of selected chemical substances as per the monograph. 2. Volumetric analysis of the chemical substances. 3. Basics of preparatory chemistry and their analysis. 4. Systematic qualitative analysis for the identification of the chemical drugs. Course outcomes. Upon successful completion of this course, the students will be able to perform the limit test for various inorganic elements and report prepare standard solutions using the principles of volumetric analysis. The test purity of selected inorganic and organic compounds against the monograph standards. Synthesize the selected chemical substances as per standard synthetic scheme. Perform qualitative tests to systematically identify the unknown chemical substances. Practicals, serial number and experiment. 1. Limit test for chlorides, sulfates, irons, heavy metals. 2. Identification test for anion and cation as per Indian Pharmacopoeia. 3. Fundamentals of volumetric analysis, preparation of standard solution and standardization of sodium hydroxide, steric ammonium sulfate, potassium permanganate. 4. Assay of the following compounds: ferrous sulfate by redox titration, calcium gluconate by complexometric, sodium chloride by modified Volhard's method, ascorbic acid by serimetry, metronidazole by non-aqueous titration, ibuprofen by alkalimetry. 5. Fundamentals of preparative organic chemistry, determination of melting point and boiling point of organic compounds. 6. Preparation of organic compounds, acetanilide from aniline, aspirin from salicylic acid. 7. Identification and test for purity of pharmaceuticals, aspirin, caffeine, paracetamol, sulfanilamide. 8. Systematic quantitative analysis experiments for substances. Assignments. These students shall be asked to submit the written assignment on the following topics. 1 assignment per student per session period. Per session period, that is a minimum of 3 assignment per student. 1 different monographs and formularies available and their major contents. 2 significance of quality control and quality assurance in pharmaceutical industry. 3 overview of green chemistry. 4 various software programs available for computer aided drug discovery. 5 various instrumentations used for characterization and qualification of drug. Pharmacognosy. Just wait a minute. Pharmacognosy theory. Scope of this course is designed to impart knowledge on the medicinal use or uses of various drugs of natural origin. Also, the course emphasizes on the fundamental concepts of the evolution of crude drugs, alternative systems of medicine, nutraceuticals and herbal cosmetics. Basically, we are going to learn in the pharmacognosy are the crude drugs. That is the source of the medicines, where the medicines come from, plant, animal or other sources, minerals, right? So we are going to cover those things in this pharmacognosy syllabus, right? Course objective. This course will discuss the following aspects of drug substances derived from the natural resources. 1. Occurrence, distribution, isolation, identification, test of common phytoconstituents, that is plant constituents. The product derived from the plants are called as phytoconstituents. 2. Therapeutics activities and pharmaceutical applications of various natural drugs, drug substances and phytoconstituents, biological sources, chemical constituents of selected crude drugs and their therapeutic efficiency in the common disease and elements. 4. Basic concepts in quality control of crude drugs. Basic concepts in quality control of crude drugs and various systems of medicine. Applications of herbs in health, food and cosmetics. Courses outcomes. Upon successful completion of this course, the student will be able to 1. Identify the important common crude drugs of natural origin. 2. Describe the uses of herbs in nutraceuticals and cosmeceuticals. Nutraceuticals basically are related to nutrition, and cosmeceuticals related to cosmetics, definitely. Third, discuss the principles of alternative systems of medicine. 4. Describe the importance of quality control of drugs of natural origin. Now take a look on the definition. Chapter 1, definition, history, present status and scope of pharmacognosy. Chapter 2, classification of drugs, alphabetical classification, taxonomical, morphological, pharmacological, chemical, chemo, taxonomical. So these are various types of classifications that you will be studying. Chapter 3, quality control of crude drugs, different methods of adulteration of crude drugs, evaluation of crude drugs. Chapter 4, brief outline of occurrence, distribution, isolation, identification test, therapeutic activity in pharmaceutical, applications of alkaloid, terpenoid, glycosides, volatile oils, tannins and rannins. Chapter 5, biological sources, chemical constituents and therapeutic efficacy of the following categories of crude drugs: laxatives, aloe, castor oil, spagula, senna, cardiotonic, digitalis, arjuna, carminative and GI regulators, coriander, fennel, cardamom, ginger, clove, black pepper, asafoetida, nutmeg, cinnamon. Astringents, myrobalan, black catechu, drugs acting on nervous system, hyoscyamus, belladonna, ephedra, opium, tea leaves, coffee seeds, coca. Antihypertensives, rauwolfia, anti-tissue, antitussive, vasaka, tolu balsam, anti-rheumatics, colchicum seed, anti-tumor, vinca, podophyllum, anti-diabetics, pterocarpus, gymnema, diuretics, gokru, punarnava, anti-dysenteric, ipecacuanha. Antiseptic and disinfectants, benzoin, myrin, neem, turmeric. Antimalarials, cinchona, artemisia, oxytocic, ergot. Vitamins, cod liver oil, shark liver oil. Enzymes, papaya, diastase, pancreatin, yeast. Pharmaceutical aids, kaolin, lanolin, beeswax, acacia, tragacanth, sodium alginate, agar, guar gum, gelatin. Miscellaneous: squill, galls, pale catechu, ashwagandha, osaka, tulsi, guggul. Chapter 6: plant fibers used as surgical dressings: cotton, silk, wool, and regenerated fibers. Sutures, surgical catgut, and ligatures. 7. Basic principles involved in traditional systems of medicines like Ayurveda, Siddha, Unani, and homeopathy. Methods of preparation of Ayurvedic formulations like Arishta, Asva, Gutika, Tela, Churna, Leha, and Bhasma. 8. Role of medicinal and aromatic plants in national economy and their export potential. 9. Herbal and health food. Brief introduction and therapeutic applications of nutraceuticals, antioxidants, probiotics, prebiotics, dietary fibers, omega 3 fatty acids, spirulina, carotenoids, soya, and garlic. 10. Herbal cosmetics. Sources, chemical constituents, commercial preparations, therapeutic cosmetic uses of aloe vera gel, almond oil, lavender oil, olive oil, rosemary oil, sandalwood oil. 11. Phytochemical investigations of drugs. Pharmacognosy practical. This course is designed to train the students in physical identification, morphological characterization, physical and chemical characterization, and evaluation of commonly used herbal drugs. Course objective: this course will provide hands-on experiences to the students in identification of the crude drugs based on their morphological characteristics. Various characteristics, anatomical characteristics of herbal drugs studied through transverse section. Physical and chemical tests to evaluate the crude drugs. Courses outcomes: on successful completion of this course, the student will be able to: 1. Identify the given crude drug based on the morphological characteristics. 2. Take transfer sections of the given crude drug. 3. Describe the anatomical characteristics of the given crude drug under microscopical conditions. 4. Carry out the physical and chemical tests to evaluate the given crude drugs. 1. Morphological identification of the following drugs: Ipagula, senna, coriander, fennel, cardamom, ginger, nutmeg, black pepper, cinnamon, clove, ephedra, rauwolfia, gokru, punarnava, cinchona, agar. Gross anatomical studies, transverse section of the following drugs: ajwain, datura, cinnamon, cinchona, coriander, ashwagandha, licorice, clove, curcuma, nux vomica, osaka. Physical and chemical test for evaluation of any 5 of the following drugs: asafoetida, benzoin, pale catechu, black catechu, castor oil, acacia, tragacanth, agar, guar gum, gelatin. Assignments: the student shall be asked to submit the written assignment on the following topics: 1 assignment per student per sessional period, that is a minimum 3 assignment per student. 1. Market preparations of various dosage forms of Ayurvedic, Unani, Siddha, homeopathic, classical, and proprietary. Indications and their labeling requirements. Marketing preparations of various herbal cosmetics, indications and their labeling requirements. Field visits. The students shall be taken in the groups of a medicinal garden to witness and understand the nature of various medicinal plants, discuss the theory and practical courses. Additionally, they shall be taken in groups to the pharmacies and traditional systems of medicine to understand the availability of various dosage forms and their labeling requirements. Individuals report from each student on their learning experience from the field visit shall be submitted. Now let's come to the syllabus of human anatomy and physiology. Scope. This course is designed to impart basic knowledge on the structure and function of the human body. It helps in understanding both homeostasis mechanisms and homeostatic imbalances of the various systems of the human body. Course objectives. This course will discuss the following: 1. Structure and functions of various organ systems and organs of the human body. 2. Homeostatic mechanism and their imbalances in human body. Homeostatic mechanism and their imbalances in the body. Various vital physiological parameters of the human body and their significances. Course outcomes. Upon successful completion of this course, the students will be able to describe the various organ systems of the human body, to discuss the anatomical features of the important human organs and tissues. 3. Explain the homeostatic mechanism regulating the normal physiology in the human system. 4. Discuss the significance of various vital physiological parameters of the human body. Chapter 1. Scope of anatomy and physiology. Definitions of various terminologies. Chapter 2. Structure of cell, components and its functions. Chapter 3. Tissue of human body: epithelial, connective, muscular and nervous tissues, their subtypes and characteristics. 4. Osseous system: structures and functions of bones, of axial and appendicular skeletal. Classification: types of movements of joints, disorders of joints. 5. Hemopoietic system: composition and functions of blood, process of hemopoiesis, characteristics and functions of RBCs, WBCs and platelets. Mechanism of blood clotting. Importance of blood groups. 6. Lymphatic system: lymph and lymphatic system, composition, functions and its formation, structure and function of spleen and lymph node. 7. Cardiovascular system: anatomy and physiology of heart, blood vessels and circulations, pulmonary, coronary and systematic circulation, cardiac cycle and heart sounds, basics of ECG, blood pressure and its regulation. 8. Respiratory system: anatomy of respiratory organs and their functions, regulations of mechanism of respirations of respiratory volume and capacities, definitions. 9. Digestive system: anatomy and physiology of gastrointestinal tract, that is GIT, anatomy and functions of accessory glands, physiology of digestion and absorption. 10. Skeletal muscles: histology, physiology of muscle contraction, disorders of skeletal muscles. 11. Nervous system: classification of nervous system, anatomy and physiology of cerebrum, cerebellum and midbrain. Functions of hypothalamus, medulla oblongata and basal ganglia. Spinal cord structure and reflexes, names and functions of cranial nerves, anatomy and physiology of sympathetic and parasympathetic nervous system, that is ANS. Sense organs, chapter 12, anatomy and physiology of eye, ear, skin, tongue and nose. Chapter 13, urinary system, anatomy and physiology of urinary system, physiology of urine formation, renin-angiotensin system, clearance test and micturition. Chapter 14, endocrine system, hormones and their functions, pituitary gland, adrenal gland, thyroid and parathyroid gland, pancreas and gonads. Chapter 15, reproductive system, anatomy of male and female reproductive system, physiology of menstruation, spermatogenesis and oogenesis, pregnancy and parturition. Human anatomy and physiology practical. This course scope. This course is designed to train the students and instill the skill for carrying out basic physiological monitoring various systems and functions. Course objective. This course will provide hands-on experience in the following: 1. General blood collection techniques and carrying out various hematological assessments and interpreting the result. 2. Recording and monitoring the vital physiological parameters in human subjects and basic interpretations of results. Microscopic examinations of various tissues permanently mounted in glass slide. Discuss the anatomical and physiological characteristics of various organ systems of the body using models, charts and other teaching aids. Course outcomes. Upon successful completion of this course, the student will be able to: 1. Perform the hematological test in human subject and interpret the results. 2. Record, monitor and document the vital physiological parameters of human subject and interpret the result. 3. Describe the anatomical features of the important human tissues under the microscopical conditions. 4. Discuss the significance of various anatomical and physiological characteristics of human body. Practicals. 1. Study of compound microscope. 2. General techniques for collection of blood. 3. Microscopic examination of epithelial tissue, cardiac muscle, smooth muscle, skeletal muscle, connective tissue, nervous tissue. Ready prepared slides. Study of human skeletal, axial skeletal and appendicular skeleton. Study of appliances used in the hematological experiments, only identification and listing appliances. Determination of blood group ESR, that is erythrocyte sedimentation rate, hemoglobin content of blood, bleeding time and clotting time. 7 is determination of white blood cell count of blood, determination of red blood cell count of blood, determination of differential count of blood, recording the blood pressure in various posture, different arms, before and after exerting the and interpreting the result. Recording of body temperature using mercury, digital and infrared thermometers at various locations, pulse rate, heart rate at various locations in the body before and after exertion. respiratory rate. Recording of force of air expelled using the peak flow meter, measurement of height, weight, and BMI, study of various systems of organs with the help of chart, models, and specimens, cardiovascular system, respiratory system, digestive system, urinary system, endocrine system, reproductive system, nervous system, eye, ear, skin. That's it. Now, social pharmacy theory. Scope. This course is designed to impart the basic knowledge on public health, epidemiology, preventive care, and other social health related concepts. Also, to emphasize the roles of pharmacists in the public health programs. Course objective. This course will discuss about the basic concepts of public health and national health programs, preventive health care, food and nutrition related health issues, health education promotion, general roles and responsibilities of pharmacists and in public health. Course is outcome. Upon successful completion of this course, the student will be able to discuss about the roles of pharmacists in the various national health programs, describe the various sources of health hazards and disease preventive measures, discuss the healthcare issues associated with food and nutritional substances, describe the general roles and responsibilities of pharmacists in public health. Chapter 1, Introduction to Social Pharmacy, definition and scope of social pharmacy as a discipline and its scope in improving the public health, role of pharmacist in public health, concept of health, WHO definition, World Health Organization, various dimensions, determinants and health indicators, national health policy, Indian perspective, introduction to Millennium Development Goals, Sustainable Development Goals, FPI Development Goals, preventive healthcare, role of pharmacist in the following, demography and family planning, mother and child health, importance of breastfeeding, ill effects of infant milk substituents and bottle feeding, overview of vaccines, types of immunity and immunization, effect of environment on health, water pollution, importance of safe drinking water, waterborne disease, air pollution, noise pollution, sewage and solid waste disposal, occupational illness, environmental pollution due to pharmaceuticals, psychosocial pharmacy, drugs of misuse and abuse, psychotropics, narcotics, alcohol, tobacco products, social impacts of these habits on social health and productivity and societal behaviors. Chapter 3, nutrition and health, basics of nutrition, macronutrients and micronutrients, importance of water and fibers in diet, balanced diet, nutrition deficiency disease, ill effects of junk food, calorific and nutritive values of various food, fortification of food, introduction to food safety, adulteration of food, effects of artificial ripening, use of pesticide, genetically modified foods, dietary supplements, nutraceuticals, food supplements, indications, benefits, drug food indicators or indications. Chapter 4, Introduction to Microbiology and Common Microorganisms. Introduction to microbiology and common microorganisms. Epidemiology. Introduction to term epidemiology. Its application terms such as epidemic, pandemic, endemic, mode of transmission, quarantine, isolation, incubation period, contact tracing, causative agents, epidemiology, clinical presentations, and role of pharmacists in educating the public in prevention of following communicable disease like respiratory infections such as chickenpox, measles, rubella, mumps, influenza, including avian flu, H1N1, SARS, MERS, COVID-19, diphtheria, whooping cough, meningococcal meningitis, acute respiratory infections, tuberculosis, and Ebola. Intestinal infections, poliomyelitis, viral hepatitis, cholera, acute diarrheal disease, typhoid, amoebiasis, worm infestations, food poisoning, arthropod-borne infections, dengue, malaria, filariasis, and chikungunya, surface infections, example trachoma, tetanus, leprosy, STDs, HIV/AIDS. Chapter 5, Introduction to Health Systems and all ongoing national health programs in India, their objectives, functioning, outcomes, and roles of the pharmacist. Chapter 6, Role of Pharmacist in Disaster Management. Chapter 7, Pharmacoeconomics. Basics, health insurance, health maintenance, organization, HMOs, health spending, out of pocket expenses. Social pharmacy practical. This course is designed to provide simulated experiences in various public health and social pharmacy activities. Course objective, this course will train the student on various roles of pharmacist in public health and social pharmacy activities in the following areas. 1. National immunization programs. 2. Reproductive and child health programs. 3. Food and nutrition related health programs. 4. Health education and promotion. 5. General roles and responsibilities of the pharmacist in public health. 6. First aid for various emergency conditions including basic life support and cardiopulmonary resuscitation. Course outcomes. Upon successful completion of this course, the student will be able to describe the roles and responsibilities of pharmacist in various national health programs. 2. Design promotional materials for public health and awareness. 3. Describe the various health hazards including microbial resources. 4. Advise on preventive measures for various disease. 5. Provide first aid for various emergency conditions including basic life support and cardiopulmonary resuscitation. Note: demonstration, hands-on experience, preparation of charts, models, promotional materials, role plays, enacting, e-brochures, e-flyer, podcasts, video podcast, any other innovative activities to understand the concept of various elements of social pharmacy listed here. At least one activity to be carried out for each one of the following. Extremely sorry for the background noise. Practicals. 1. National immunization schedule for children. Adult vaccine schedule. Vaccines not included in the national immunization programs. RCH, reproductive and child health. Nutritional aspects. 3. Family planning devices. 4. Microscopical observation of different microbes. Ready-made slides. 5. Oral health and hygiene. 6. Personal hygiene and etiquettes. Hand washing technique. Cough and sneeze etiquettes. Various types of masks. PPE. Just a second. Menstrual hygiene products used, marketed preparations, disinfectants, antiseptic, fuming agent, antiviral agents, mosquito repellents, etc. 9. Health communication, audio, video, podcast, images, PowerPoint slides, short films, etc. in regional languages for mass communication, education, awareness on 5 different communicable diseases, their signs and symptoms, and prevention. Water purification technique, use of water testing kit, calculation of content, percentage of KMNF4, bleaching powder to be used for wells, tanks, counseling children on junk food, balanced diets using information, education, communication, ICE, information, education and communication, counseling, etc. Simulation experiments. 12. Preparation of various charts on nutrition, sources of various nutrients from locally available foods, calculation of caloric needs of different groups. Example: child, mother, sedentary lifestyle, etc. Chart of glycemic index of food. Tobacco cessation counseling, identification various tobacco containing products through the chart products. First aid, theory basics, demonstration, hands-on training, audio-visual and practicals. BSL, basic life support systems. SCA, sudden cardiac arrest. FBAO, foreign body airway obstruction. CPR, defibrillation using AED. Include CPR technique. First responder. Assignments. The student shall be asked to submit the written assignment and on the one of the following topics. One assignment per student per session, per sessional period, that is minimum of 3 assignment per student. An overview of antibiograms, study of the labels of various packed food to understand their nutritional content. Calorie-free sweeteners, market examples and their contents. Breastfeeding counseling guidance using information, education and communication. Information about organization, working and dedication services in the region, city, district, etc. Role of pharmacist in disaster management, a case study. Overview of on the National Tuberculosis Elimination Program. Drug disposal system in the country at industry level and citizen level. Various prebiotic or probiotic dietary and market products. Emergency preparations, study local government structure with respect to fire, police department, health department. Prepare poster presentation for general public on any one of the World Health Day. Example: TB Day, AIDS Day, Hand Washing Day, World Diabetes Day, World Heartbeat Day, World Heart Day. List of home medicines, their storage, safe handling and disposal of unused medicines. Responsible use of medicines from purchase to disposal. Collection and newspaper clips. minimum 5 relevant to any one topic, and its submission in an organized form with collective summary based on the news items. Read a minimum one article relevant to any theory topic from pharma science or other periodicals, and prepare summary of its for submission. Mental health and its significances among the various segments of society. Potential roles of pharmacists in rural India, right? Field visit. These students shall be taken in groups to visit any three of the following. Right? Facility to witness and understand the activities of such centers, facilities from the perspective of the topic discussed in the theory and practical courses. Individual reports from each student on their learning experience from the field visits shall be submitted. 1. Garbage treatment plant. 2. Sewage treatment plant. 3. Biomedical waste treatment plant. 4. Effluent treatment plant. 5. Water purification plant. 6. Orphanage, elderly care home, school or hostel, home for persons with disabilities, primary health care centers. Now that was end of part 1 of the syllabus. Now part 2. We will cover the part 2 in the next video. Thank you for watching. Have a great day.